So this training is mandatory for not only staff in our department, but also anyone that has the potential to be in contact with, say, a mobile X-ray up on the wards. So we have done, well, I don't know percentage-wise, but probably maybe 40% of the nurses around the hospital have done this. A lot of the doctors in theatre as well we did a talk for. But yeah, basically this is kind of we're killing two birds with one stone. I'm doing my talking, getting out of the way, and we're also doing the yearly training for everyone after they've all watched this. So training is included but not limited to radiographers, sonographers, admin staff, nurses and students. Yeah. And as I said, it can also be for anyone within the district who may be exposed to a source of radiation. All right. So the objectives of this one is to increase our understanding of radiation and radioactivity in the healthcare setting, help staff be aware of safe principles and safe practices. In the outline, so we're going to talk a little bit about history and theory of radiation, a little bit about how X-rays work and radiation measurements, discuss the differences between natural and man-made radiation. How do I get rid of that thing, Cam?
What's that, mate?
The thing on the bottom right. Do I just click?
Just click on it.
Oops.
Oops.
Hang on.
What?
Anyway, and also how to minimise our occupational exposure. It's gone now. So what do you think of when you first think of radiation? Like, put all X-ray and what you know about it out the window. When you were 12 years old and you heard radiation, what did you think of, Chris?
Bombs. Nuclear bombs.
Well, okay, yeah, well that's one thing, I suppose, yeah. Most people, when I did this talk for the intern doctors and the students, they all said the Hulk. Yeah. Other things, you know, I always think of The Simpsons because I love The Simpsons. You know, Radioactive Man and Blinky. And I guess it's sort of, all this publicity, or, you know, how they portray radiation in movies and TV shows, it really does give it a bad name. People sometimes think they're going to start glowing green from X-rays, which, as we all know, is far from the truth. All right. So who discovered radioactivity? Togs, you want to make a beer?
Who discovered it?
Yeah.
Becquerel.
Excellent. Yeah, Antoine Becquerel. So he worked with uranium and noticed the phosphorescence caused film exposure after in the sun. Obviously film exposure led to X-rays, okay, so principles there. All right, and he discovered in 1896, which means that the effects of radioactivity has been studied for over 100 years now. And they're still studying it. And there he is, the handsome bugger. The Curies, I'm sure we all know about the Curies. So Marie Curie, along with her husband Pierre, discovered radium and coined the term radioactive. She was the first woman to win 2 Nobel Prizes. And back those days they did not really understand the harmful effects of the sources of radiation, so they typically would carry them around in their pockets around the labs. Now Marie Curie did die from cancer. It's never been officially attributed to radiation. If anyone can tell me, you're not allowed to because I know you know the answer. If anyone can tell me how her husband died, you can have a beer. I'll buy you a beer or a wine or a bowl of ice cream for you, Cammy.
He was run over by a horse and carriage.
I guess I'll owe you a beer then.
Was he?
Yeah, it was. He fell out of a horse and carriage. Put it on my tab. Yeah. All right. So, who discovered X-rays? This is something we all know. That was this handsome man, William Röntgen. So he worked with a Crookes tube, which was basically sort of an early X-ray tube to study cathode rays. Discovered X-rays in 1895, and took the first radiograph of his wife's hands. So his wife's hand. Sorry, Trev. Yeah, his wife's hand. So there's the famous first X-ray. Obviously, if we were doing it, we would have removed the rings, but we'll give him a break since it was his first crack. Yeah. All right. So types of radiation: alpha, beta, photons. So alpha particles. Oh, I forgot they were on there. Alpha particles will be stopped by paper. Beta particles will be stopped by tissue, and photons such as X-rays will pass through tissue which is obviously contributes to an X-ray being formed or a radiograph being formed. All right, and yeah, stopped by concrete and lead, which is why we always have lead-lined rooms. Now, how X-rays work, I'm sure most of you remember something about this from uni. So the cathode is heated, emits electrons. The electrons are accelerated across the vacuum by high voltage, striking the anode and producing X-rays. Okay. So that's what our X-ray tubes look like inside. And only about 1% of that energy that is made is transformed to X-rays. What's the rest, anyone?
Heat.
Absolutely. Alright, so why is radiation harmful? So it can cause changes in human cells by interfering with the way it functions. The damage to cells may cause mutations and cancer. So when a cell is damaged and exposed, there's three things that can happen. It can repair as normal, it can die, or it can transform. Now which one would be the one we don't want to happen the most? Any ideas?
Transform.
Yeah, absolutely. And that was the only kind of cell picture I could find. I thought it looked pretty cool. Alright, so acute effects of radiation generally occur in the cells that are most sensitive, so the cells that are rapidly dividing, such as blood-forming cells, gastrointestinal cells. And this is why people exposed to high doses at short times usually have gastrointestinal symptoms. Hopefully I will never experience any of those two in an X-ray room, because I'd probably be vomiting as well. Yeah. Alright, how do we measure radioactivity? So historically it was the Becquerel and the Curie, obviously named after the people we spoke about. That measured radioactivity only. Effective doses is what we deal with these days. So this basically combines the radioactivity and the medical effects on the human tissue. So it used to be REMS, but these days, as we know, you only hear sievits, and one sievit is about 100 REMS. So, sorry mate. So these are just some typical effective doses in medical imaging. So I guess I only put this one in there to show some of the doctors when I was doing that. It shows sort of the discrepancy between an X-ray and a CT. So have I got a mouse in here? Yes. So looking at chest radiograph, we're getting an approximate effective dose of 0.025. And I thought there was a chest CT on here, but it's sort of 4 to 5 millisieverts. So you imagine there's a huge discrepancy in the effective dose the patient's receiving. So what I was telling the doctors was, now that you know that, have a really big think before you go CT over X-ray. So hopefully they listen to me, but we will see. Oh, that's a bit bigger if anyone wanted to have a look. Yeah, everyone's happy? Alright, so radiation exposure. So the current safety practices focus on keeping our occupational exposure as low as reasonably achievable. However, this occupational exposure is only a fraction of what we're receiving in a year. Okay, so radiation's everywhere. You're constantly being exposed to ionising radiation by multiple sources. In fact, the fact that we're sitting next to each other, we're actually receiving radiation from one another as we speak. So if you want to disperse a little bit, I'll understand. Natural radiation, so things like cosmic rays, radon, the human body and the earth. So here, this one down here, I don't know if you can read it, but it's got saying about roughly 300 millirems a year. So that's about 3 millisieverts a year from natural sources. In Australia, it's more like 2 to 2.4, depending on sort of where you are. There is places like Colorado, higher altitude, slightly higher, a bit closer to 4 millisieverts a year. All right. So background radiation, as we said, radon, sort of basements, water supplies. Cosmic is outer space. Terrestrial, soil, rocks and plants, and as I said, about 2 millisieverts a year in Australia. Okay. Now foods and radiation. Can anyone tell me a food that's high in radioactivity? Bananas, very good. So all living things require potassium. About 1 in every 8,500 atoms is a radioactive isotope, potassium-40, meaning that all food is emitting a little bit of radiation. So as bananas are high in potassium, one of the most radioactive foods. eating 200 bananas is about the equivalent of one chest X-ray, they say. Other literature I read said 100. It's kind of varied depending on.
Size of banana.
Well, that's true as well. Yeah,
It's a
yeah.
leaf finger or
Where
a
was
big-
it? What was it called?
Bites.
How so other foods. Sorry. Oh God, but yeah. Other foods include Brazil nuts, carrots, potatoes, red meat, drinking water, and also beer, which was the one that shocked me. But I've switched to rum now, so it's all good. So that fella there that looks a bit like Cameron, he's getting through a chest X-ray as we speak. Has anyone ever had a bone density scan? Or performed them? I don't know. I used to do them all the time up at the Mater here, and we used to just stay in the room because the dose was kind of negligible. And yeah, they say about 4 bananas is approximate per body part, and they generally do 2 body parts for those, so be 8 bananas and yeah, you're out at about the same level of radioactivity. All right. Man-made radiation. So what could this include?
X-ray.
Yeah, very good. Yeah. So primarily diagnostic X-rays and CTs, medical. Less common, fallout from atomic bombs and nuclear power make up a small amount, and consumer products, so building materials, colour TV sets, the old CRT monitors, which I've never seen apart from the one my dad still uses. Haven't seen one for many years.
You're viewing
Is there?
Yeah, the monitor you're viewing with the patients. In the
Uh-huh.
waiting room.
Oh, that. Oh yeah, I was talking about computer screens, but I suppose that one
Yeah.
counts as well. Yeah, yeah, that thing's seen better days. So looking down again where we were looking before, we're talking roughly 70 milligrams to about 0.7 millisieverts. Obviously that's very variable. I mean, I'm sure we all know that one patient that's come in for 20 CT head and C-spines after having a few too many and falling over. Obviously their level will jump up, okay? All right, so annual dose limits. Anyone know what our annual dose limit is?
20?
Yeah, 20. All right. So general public is 1 millisievert, and occupational limit is 20 millisieverts. I always find this funny because I don't really see how we're 20 times more susceptible, but I suppose it's set in place to kind of control the public as well.
When you did lots of screening.
Yeah, well, that's true.
It's
Yeah.
not that, it's basically the public, you don't have a
Don't have a
cumulative dose collection.
Yeah.
Where written
Mm.
down, so
Yeah, got to keep it steady. What was this? You were telling me about that thing in England where they have a card.
in
And
America.
in America, okay, yeah.
They're trying to introduce it in.
Yeah. So I think that's a really good idea. So Michael was telling me, I don't know, a couple of weeks back about this card that they sort of swipe and their dose gets put on there and they can keep a track of their exposure. Yeah. So I think that's a great idea. I think Australia should do it as well. Yeah. All right, so this 20 millisieverts is averaged over 5 years. You want to have less than 100 over the 5 years. I don't know how many of you keep track of your numbers, but it's highly unlikely that any of us here are ever going to reach that limit. So hopefully we don't. All right. So a bit more on that. So all of the Wide Bay personnel that work with these radiation sources are considered radiation workers subject to the occupational dose limits. So these limits do not include background radiation or any personal medical radiation received. So please, if you're having a CT somewhere, don't wear your badge. Yeah, it's not a good idea. So yeah, there is maximal medicinal doses for different parts of the body. So the whole body, head, neck and torso is what we spoke about, 20 millisieverts. The lens of the eye, 150 millisieverts. And extremities, 500 millisieverts. Okay, so yeah, since extremities are slightly less susceptible, and that's why they're a bit higher, we can get away with a bit more. Alright, so these doses that they receive within these limits are not expected to cause any adverse health effects, even if the maximum level is reached for a total of 50 years. So, as we know, 20 millisieverts, we're never going to hit there. I think the last I checked, I was 1.6 year for my total lifetime dose. So, yeah, and I think I'm the highest here. last I checked. Alright, so health effects on ionising radiation. So a dose range up to 10 millisieverts, this shouldn't be any direct evidence of human health effects. 10 to 1,000, no early effects, an increased incident of certain cancers in exposed populations at these doses. From 1,000 up to 10,000 millisieverts, radiation sickness with the risk of death and increased incident of certain cancers. Anything above 10,000 millisieverts is always fatal. So we'll never see doses like that in any of our jobs, but just to show you that it does take a fair whack of radiation to be always fatal. Now, prenatal radiation exposure. So declared pregnant worker is a woman who's voluntarily chosen to declare a pregnancy in writing to myself or Michael. Maximum permissible dose to an embryo or a fetus of this worker is 1 millisievert for the entire pregnancy. Okay, that's a pregnant lady, I think. Yeah. So measuring occupational doses, this slide mostly was put in for the doctors to show them, but we all know how we do it. We wear our TLD badges and they record the occupational exposure. Okay, so there's a couple of examples. That was the closest one I could find to ours that didn't have a name on it online. And as you all know, we keep a control badge. We just keep it in the folder in that middle area up above. And yeah, that sort of, they can work out what was background radiation, what was occupational radiation by working out the differences. So the guidelines for these is, if you're issued a badge, it's your responsibility. So please follow these guidelines. And all the readings you get are recorded on your history. So wear only the badge assigned to you. Do not wear your badge while having any personal procedures done. Never intentionally expose your badge or anyone else's to radiation. So if you ever want to know what's inside one, maybe just Google it rather than x-raying it. And if your badge is lost or damaged, please call or let me or Michael know straight away and we can do a replacement. We do have a couple of spares sitting in there. Alright, what's the biggest issue with x-rays that we face in regards to radiation exposure?
The scatter.
Ah, bugger. I'm not very good at PowerPoint. Okay, I did not see that bit. Alright, so yeah, scatter radiation. So during the image formation, about 30% of the produced X-rays bounce or scatter off the patient and they have the potential to expose us or any other staff in the vicinity, okay? So generally present within the 2 metre radius of the patient, and this reduces very quickly as we know with distance. Okay, so the further away you are, the better. Now in general, the more radiation the patient receives, the more that we could receive, as a general rule. So obviously if we're zapping them at a higher rate, higher exposure factors, there's potential for more scatter. Alright, ALARA. Everyone should know this. You remember what it all stands for? I heard that, so I'll count that as a yes. Yeah. Alright. It stands for as low as reasonably achievable. APRA regulations require that we make every effort to minimise the exposure and keep it as low as reasonably achievable. Alright. So every individual here can implement ALARA by limiting their personal times near the X-ray sources, being aware of scattered radiation, utilising shielding whenever possible. And also, I didn't put this in for the doctors, but also obviously controlling your exposure factors, which we all know. Alright, 3 general concepts of minimising radiation exposure: time, distance and shielding. So time, radiation dose directly proportional to the time an individual is exposed. And operators should try to minimise time next to X-ray equipment while it's operating. So I guess for X-rays, we're talking milliseconds for the majority of exposures. This more comes into play with things like fluoroscopy, where you have the potential of sort of a 2 or 3 minute screening time if it's a bit of a tricky procedure. Yeah. Alright, and distance. We all know the inverse square law, I'm sure. So basically, the more distance between you and the source, the less exposure you receive. The inverse square law states that if you double the distance you are from the source, you're quartering the dose. Okay, so I think I've got a graphic. Yeah, there it is. So yeah, as you can see, the further they get away, the less dose you're receiving. And shielding. So obviously, if we're using, there's a spelling error there, sorry. Application of shielding provides a barrier between you and the source of the radiation. Now, as on that slide we saw before, the radiation does not get through concrete or lead. Okay, so things like our lead aprons, our thyroid shields, our lead glass and walls. We also do have a pair of gloves. I don't think we have any glasses, but I think the only people I've ever seen wearing lead glasses were surgeons. Sorry?
We did have some.
You have some?
Stored out the front there.
Okay, yeah. I've only seen it in urologists doing like 5-minute procedures, but yeah. And as you all know, they must be hung up properly to prevent cracking of the lead. And that picture I like because it kind of looks like they're modelling them for a Lowe's catalogue. Yeah. Anyway, warning signs. We have plenty of warning signs in our department, and these are there, highly visible. They help limit any unnecessary exposure to staff or patients by someone walking in where they're not supposed to. Okay, so these aren't our ones, but they're just some examples of what they can look like. Few reminders. So when we do have a fluoro, we want to minimise the amount of fluoroscopy time for October. Use proper collimation of your primary beam. Whenever possible, maintain the greatest distance between the patient and the primary beam. This is more talking about theatre and fluoro again. Keep the II as close to patient as possible. So it decreases patient dose, also the personnel dose, and also improves the quality of the image. So lead garments, thyroid shields, barriers between patient and personnel all reduces exposure to scattered radiation. A couple of comparisons to finish the talk off. So this may be hard to see. So on the side of the blue, every dot counts to 0.05 of a microsievert, and on the green dots, that's 20 microsieverts. So if we look, what did I do? Wrong way. Where's your mouse? So if we look at this first one, one blue dot, 0.05 of a microsievert, that's sleeping next to someone for a night. Okay. Oh God, where's it gone? They're here, 0.1 microsievert, eating one banana. As we move down, we've got a dental X-ray and OPG at about 5. Background dose received by an average person on a day is 10 microsieverts. And an airplane flight from New York to LA, which I'm not sure of the timing, 6 hours, 5 hours? Yeah, about 40 microsieverts. All right, so we look over here. Our first dot here, 20 microsieverts for a chest X-ray. As we move down a little bit, this one here is your yearly dose from the natural potassium in your body, and that's about 390, which is comparative to a mammogram at 400. All right, we're starting to move down to a bit more radiation. So down here is the head CT scan, 2 millisieverts. Here is the normal yearly background dose, which is, they say that's calculated at about 4 millisieverts, so this may be from somewhere in Colorado. Okay. And the one that I always like to talk to about doctors is, here we have 1 dot, and that's a chest X-ray. Here we have however many dots, that's a chest CT scan. So it is significantly higher radiation. And the final one, the massive one, is the maximal yearly dose for US radiation workers. For some reason theirs is 50, whereas ours is 20. Not really sure why.